Okay, so I'm going to start the same way that I started for chapter 26. This one is 27, care of patients with disorders of the eyes and ears. And since I've already been lectured on it, I'm just going to start with the questions in the back of the book, do the objectives if it's relevant or if I think it'll actually help. Majority of the time it helps. And I'm going to go through the chapter itself to determine what the teacher said was important, what I thought was important, and just kind of do that. And then I'm going to wrap up with the evolve questions as well to test my knowledge some more. Alrighty. And this time I was prepared. I actually had the answers pulled up. Alrighty, so 1. A male patient was informed that he would need to wear a pair of corrective lenses for astigmatism. When asked about the condition, the patient demonstrates understanding when he states that astigmatism is hardening of the ciliary muscles. Astigmatism is an irregular curvature of the cornea. Astigmatism enables focusing of light in front of the retina. Or astigmatism is an increased opacity of the lens. It's an irregular curvature of the lens. Cornea, not lens. Yes, it is correct. Astigmatism is caused by an irregular curvature of the cornea. The exact definition. When instruction must be included in the discharge teaching of a patient who has undergone which instruction must be included in the discharge teaching of a patient who has undergone corneal transplantation? I keep wanting to add words. Cornea transplant. You got increased physical activity, wear an eye shield when in close contact with children or pets, remove pressure dressing as needed, lie only on the operative side. It's definitely not A and it's definitely not D, so it's B or C. I'm going to go with B, wear an eye shield when in close contact with children or pets. Yes. The patient should protect the eye of an eye shield when around children or pets to prevent an accidental injury to the eye with disruption of the corneal transplant. It also probably helps prevent infection as well as its healing. A woman complains of eye itching, tearing, halos around lights, and decreased central vision. Which symptom most clearly relates to macular degeneration? Oh, okay. List of symptoms and which one deals with macular degeneration. Oh, okay. Eye itching, tearing, halos around lights, or decreased central vision. Decreased central vision? No, it is halos around lights. Increasing complaints about glare are associated with the growth of a cataract. Retinopathy is frequent in patients with diabetes, either from overgrowth of... I'm looking at the wrong one. Oh no, I was right. Okay, it is decreased central vision. A decrease in central vision is most characteristic of macular degeneration. Okay, number 4. An elderly patient is admitted for cataract extraction. Which sign or symptom is associated with this condition? Increased tearing, increased farsightedness, increasing complaints about glare, or bluish discolorations. It is increasing complaints about glare. Yes, because, I gave the answer away a minute ago. Increasing complaints about glare associated with growth of cataract. I don't understand how the rest of this deals with that, but okay. Blank is a condition common in diabetic patients that causes impairment of vision and if not controlled leads to blindness. The answer is retinopathy. The damage to blood vessels from diabetes causes small hemorrhages within the retina that interferes with vision and can eventually cause blindness. Alrighty, number 6. Following eye surgery, the patient is instructed to avoid movements that increase the I can't pronounce today. Vein pressure in the head, neck, and eyes, which movements increases venous pressure. Select all that apply. Straining, bending over, keeping the head up, sudden head movements, and strenuous exercises. Increase pressure, straining, bending over, and strenuous exercises. The correct answer is straining, bending over, and strenuous exercises. Straining with lifting heavy objects or to pass stool, bending over with the head down, and strenuous exercise can all increase intracranial pressure and venous pressure in the head and neck, which in turn increases intraocular pressure. Alrighty, before eye surgery, the patient is instructed to take stool softeners. When asked about the rationale for taking stool softeners, the nurse appropriately responds, the medication reduces the possibility of straining at stool postoperatively. The medication prevents constipation caused by anesthetic agents. The medication cleanses the gastrointestinal tract, or the medication enhances surgical recovery. Well, considering we just discussed that in the previous question, it's going to be reduces the possibility of straining at stool postoperatively. Yep. Stool softeners help decrease the possibility of straining to pass stool. Straining may cause increased intraocular pressure. Alrighty, number 8. Older adults are more prone to conductive hearing loss and tinnitus because of hypertrophy of the cerebrum glands, hardened cerebrum, widening of the auditory canal, hair loss in the auditory canal. It is going to deal with, I think, hardened cerebrum. Yes, that is correct. With age, cerebrum becomes less moist and may harden, make it difficult to be expelled on its own. The hardened cerebrum may cause a conductive hearing loss if not removed. How it deals with tinnitus, I don't know. Alrighty, number 9. The nurse emphasizes safety precautions to a 60-year-old Hispanic female patient with Meniere's disease. An appropriate nursing approach would be to use first name when addressing the patient, include family members in instructions, address decision-making to the patient, set specific schedule for providing instructions. Maybe include family members? Yes, that is correct. Including family members when giving safety instructions will help reinforce needed interventions and help keep the patient safe from falls. Number 10. Which instructions would be appropriate post-operative teaching for a patient who has had eye surgery? Select all that apply. Cough or sneeze with the mouth open. Resume routine exercises. Avoid bending or heavy lifting. Keep ear dry by plugging with cotton covered with petroleum jelly. Drink with a straw. I would think resume routine exercises. Avoid bending over or heavy lifting. That's all that I can think of. I was wrong. So it's 1. Appropriate, really? Okay, so the answer is cough or sneeze with the mouth open, avoid bending or heavy lifting, and keep ear dry by plugging with cotton covered with petroleum jelly. After ear surgery, one should cough or sneeze with the mouth open to prevent an increase in intracranial pressure or change in estuin tube pressure that can disrupt suture lines. Heavy lifting is to be avoided, as is bending over so as to prevent an increase in intracranial pressure and pressure within the ear. The ear is to be kept dry with the use of petroleum jelly covered cotton balls that fit easily into the canal and prevent the entrance of moisture. Really curious how the petroleum jelly plays into that. I guess we'll find out soon enough. Well, that is the end of that. Now, to the beginning of the chapter. Okay, objectives. Let's see if there's any. Yeah, there's some good ones, but I don't know the material enough to just answer them. So things that we for sure need to cover based on the objectives is describe the signs and symptoms of selected disorders of the eye and appropriate medical treatment and nursing interventions for each. Choose nursing interventions for the patient having sclera, buccal, or cataract extraction. List the signs and symptoms of selected disorders of the ear, appropriate medical or surgical treatment, and nursing interventions for each. Teach the patient with tinnitus or vertigo measures that may decrease the symptoms. Providing appropriate care for a patient who is preoperative for eye surgery. How to properly administer eye medication, which I do know that. And providing care for a postoperative ear surgery patient. Alrighty, well, we're starting off. You got common disorders of the eye, errors of refraction. So you got your classic, which is farsightedness or hyperopia, or nearsightedness, which is myopia. Hyperopia is, like I just said, farsightedness or impaired near vision. It's when the lens is too close to the retina, and instead of converging on the retina as they should for vision, it based on figure 27.1, instead of the light coming in and refracting on the lens like it should to hit the retina at a specific point, with hyperopia, it connects beyond that point, so you don't get the whole image as you should. Whereas myopia is nearsightedness or impaired far vision, and with this in the figure 27-1 with the same thing, it says the lens is too far away from the retina. So instead of, like I said, the normal, it meeting at a point at the retina, for myopia, it meets before it. And the reason why this is an issue is because your lens accommodates, so they adjust to what you're looking at, whether it be far or near. So if you're not merging at the retina like you should, if you try to accommodate with your lens to look at something, say up close, like with hyperopia, that's when it goes back and it's hard to stay focused on, it's possibly blurry. Though I don't know that for sure because I don't have either or. But yeah, it says that's because distant and near objects do not enter the eye at the same angle. So that makes sense. And then you got presbyopia, which is a fancy word for saying farsightedness with age. So you just get it with age and you become farsighted. So seeing things up close is harder. And the way that I think about it is as you age, because those muscles get harder, your eyes naturally want to relax on something that's farther away because it's a relaxed position. It doesn't cause strain. But when you try to focus on something that is up close and keeping it there, that's when it causes issues. That's how I see it anyway. Don't think I'm right, but that's just how I have to think about it. The most common, you got a couple of different ways you can treat refraction issues. You can do glasses, eyeglasses, or contact lenses. They help fix the refraction. What I was told in class is that if you do eyeglasses, if you have hyperopia, it is going to be treated with convex lenses, which is like a nipple pointing out, essentially, just not that sharp, but it's like a mountain, yeah. Whereas myopia is if you're going to wear glasses, you're treated with a concave lens, which is a cave or a valley in this case, since we used mountain earlier. And it's just to fix the refraction issue. And if it's really bad or you don't wish to wear eyeglasses and it's approved by doctors, so on and so forth, you can have LASIK, which is eye surgery. It's common for nearsightedness, but it can be done with either or. The middle layer of the cornea is reshaped with a laser, and it is it doesn't get very specific, but I feel like they either correct the refraction issue by putting something in, removing something, adjusting something. I don't know, but they fix the refraction issue that way. Uveitis is inflammation of the uveal tract. The uveal tract is the iris, ciliary body, and the trachoroid. And it says the cause is unknown, but it's maybe due to allergens, trauma, infection, or systemic diseases. And the only way to really treat it, it says, is with rest and cycloplegic drugs. So, which still deals with resting because you paralyzed it. You got choroiditis, which is an inflammation of the cornea caused by irritation or infection. It's common with dry eyes and allergies. It's treated with eye drops usually. Now, if you're going to apply eye drops, whether you got an infection or not, and you want to teach this to your patient as well, when you administer eye drops, you want to put it in the conjunctival sac, which is just your bottom eyelid. Hold the lacrimal gland so that it does not get in there, but you want to drop the eye drop from the nose to the ear, so that way if it runs out, it runs towards the ear and not to the other eye. But you want to get as much into the eye as possible, and then Also, the tip of the eye drop container, you don't want to have touched your eye or your eyelid because it will have become contaminated. You can have a corneal transplant. Usually it's done if you're having severe vision loss. And it can be fixed that way. You must warn your patient that it takes 1 to 2 weeks before any improvement is noticed. Avoid infection and teach them what is your first symptom of graft rejection, which is inflammation beginning near the graft edges. So it's on the outside going in towards the pupil. Let's see, the next part is eye trauma. If you have a foreign body in your eye, what do? Close this sucker. And both your eyes for that matter, because you don't want to move your eyes. Don't try to remove it. Don't try to put anything else in it. Just close it and go to the ER. If it's a chemical burn to the eye, you want to irrigate it. You can irrigate it if your place of work has an eye station, but you still want to go to the ER because it's going to have continuous irrigation. Yeah, occasionally you may have to pause in order to clear any secretions that the eye may have, but you just rinse, 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 rinse. Vocab word and new circlet. I can't pronounce it. It's removal of the eye. Alrighty, cataract is an opacity of the lens, produces an effect similar to one a person would get when looking through water. Your symptoms, of course, are going to be cloudiness of the eye. You might have photophobia, which is an intolerance of light. So if you think about it, if somebody has photophobia with cataracts, they're not going to stand light. Glare is going to be more common. Colors may be obscure because how the light bends off of colors and all that. And they may also need more light at night in order to see. And it will also affect your night vision. So photophobia encompasses all of that. But your main one is cloudiness. And if you're going to confirm whether or not someone has cataract, what kind of diagnostic test would you do, or instrument you would use? A slit lamp, which views the what? The outside of the eye, compared to looking at the back of it. Alrighty, glaucoma. You got two different types, open angle and narrow angle. And I'm going to stop there because I got to get dressed for work. So I stopped with glaucoma, so I need to finish from glaucoma to the end of the chapter and cover the evolved questions. Hopefully by then I'll have had done everything correctly. Alrighty.